So you've just seen how the amazing Teresa Gipson has come to the Village Healthworks, and we're so lucky to have her. And she is now joined with Deo, and they are going to be talking about the Village Healthworks and its impact on the world. First, I want to start with a sense of why we are here and how you know each other. You met Deo how?
So I met Deo through Ziwe Taba, who used to be one of the medical students that I worked with at Oregon Health Sciences University. So Ziwe connected me to Deo and said, the two of you really need to talk. And I think the first time we talked on the phone, we had 45 minutes or something, and it was like 2.5 hours later, and we were still talking, and we wanted to continue to have a conversation. So it was pretty special.
On a dating app, that would be called a success story.
It was a success story.
Yeah. And there takes a certain kind of person to want to go into what is an incredibly difficult situation to help people. It's much easier for both of you to take your medical degrees and set up shop in an affluent city. What is that little piece about you as a human being? Why not just stay in Portland?
It would be boring. As a family physician, we often talk about how we take care of people from the cradle to the grave, and so that totality of the human experience. Part of the appeal, I think, of Village Healthworks is, this comprehensive process of, we're going to talk about nutrition, we're going to do something about education, we're going to do something about health. I mean, these are all of these, determinants of health that are all being addressed at one time. And I think that's really, for me, the attraction and the power of Village Healthworks.
I want to pivot now and talk about COVID a little bit, because I'm curious as to know how COVID affected the Village Healthworks community, what was done about it, was it contained?
We have no vaccines yet, and that has been extremely demoralizing for us. So what we really did from last year, setting up tents and around on the campus, telling people social distancing and do this and that. But it's really very hard when you are telling people what to do when they do not have the means, the resources that are available to us. It sometimes really feels like adding insult to injury. Yeah. But we did everything we could, and we're still trying to do everything we can. But as you know, the only thing really that can contain this virus, vaccine, hardly anyone in Burundi is vaccinated.
Right.
Yeah. Where I, as just an observer, having gone to Kigutu for the first time, where I really saw the impact of COVID was much more around the supply chain issues. How do we get medicines in? How do we get, gasoline? So it's that impact on that infrastructure, whereas in comparison to here, where, things have slowed down, but they were much more dramatic in Burundi.
Because they were already non-existent. I mean, you had one ambulance. I mean, already the supply chain was worse than it is now during COVID in our country.
Absolutely.
So I want to talk about the Women's Health Pavilion. 1 in 33 women die with pregnancy or birthing complications in Burundi. What's the Women's Health Pavilion going to provide?
So the Women's Health Pavilion is going to provide what it takes to change those stats. And what changes those stats is access to emergency obstetrical care. And so that means that when women have complications in pregnancy, that they have skilled people who are able to manage those problems. They have access to an operating room, they have oxygen, they have blood, they have the things that their babies have, what they need to be resuscitated appropriately. That's what really changes the numbers for a skilled attendance at birth.
Which brings me to the education portion of the Village Healthworks, because you need these people to come in and teach and care for these expected mothers. You need educators to come in and help, like you said, be the scaffolding for the Village Healthworks. And so talk to me about that, and also talk to me about how you are actually home growing your own medical professionals as well.
So education is so key, and the reason why we're building this hospital the way we've been talking about is precisely to show healthcare professionals, the nurses, the doctors who are trained in Burundi who never had a chance to go outside to actually see what a dignified healthcare is. Mm-hmm. To see that it's really humanizing medicine.
And the other piece that I would add to that is that idea of creating a model. Once you learn enough, you want to teach more, and that's the model that we're creating. So we can build a hospital, and the hospital is a wonderful extension of what Village Healthworks already does. But for me, as a physician and as a teacher of medicine, the bigger build is really in this human capacity to deliver outstanding, high-level, compassionate, dignified care.
So you're both in your late 90s. You're playing Mahjong in Miami. What is the dream? What would you, at 90 years old, you look back, what's happening at the Village Healthworks, and how are the ripple effects?
I hope I can see Village Healthworks being, in a good way, more contagious than COVID and spreading all over.
So there's Village Healthworks all over the world.
And not just Village Healthworks doing that, but people inspired to actually replicate the model.
Yes.
And do that through education and training.
What about you, Teresa?
Yeah, I mean, I see. I'm sitting there with Deo in that dream there, and I'm looking, because I'm a scientist too. I'm also looking at, well, so where is my maternal mortality rate? The legacy would be, that we decreased it by 80-90%. That emergency obstetrical care was available to every woman in Burundi, every woman in the Eastern Congo, every woman in Malawi, and I mean all over the world. To see a world, that was like that, and to feel that I had a small part in that, I'd be doing more than just playing mahjong. I might be.
Well, you've lost it a little. So.
Probably.
Yeah. By the way, I'm making you sandwiches and snacks in the back. But you're very inspirational people, and I think you'll get it done.
We
I
will
think
get
your
it done.
dreams will be actualized.
We will get it done.